and welcome everyone. You are listening to Healthcare Podcast, a space where well-being awareness and action come together. I am Asma, your host, executive member at Hive Medical Academy and Hive Care, where we are committed to empowering healthcare professionals and supporting patients' awareness through education and meaningful conversations. Joining me, joining me today is our very talented co-host, Miss Aisha Batul, whose passion for healthcare communications and community engagement adds incredible value to every discussion we bring to you. Today, we
Thank you.
are discussing. Hello, Aisha.
Hi, how are you?
I'm good. How are you? Okay, Aisha,
Um,
today we are discussing a very important and often misunderstood topic, panic attacks versus medical emergencies. Many people experiences a panic attacks genuinely believe they are having heart attacks, strokes, or another life-threatening conditions. The symptoms can be frightening, overwhelming, and very real. To help
okay.
us understand this critical topic, we are welcome our wonderful guest, Dr. Arena. Hello, Dr. Arena.
Hello, Asma, and hello, Aisha. It's nice to see you today.
Hello, hope you are doing great.
Yeah, I'm well, thank you. How are you, boss?
We
Good,
are
Alhamdulillah.
fine. Thank you so much for being with us today. We are really looking forward to this important conversation. Well, Dr. Arena will explain the key differences, warning signs, and what patients should do in such situations. So let's get started. Over to you, Aisha.
Mhm.
Thank you so much, ma'am. It's me, Aisha Batul. Also, I become an executive member of Hive Medical Academy. I have some questions related to panic attack from Dr. Arena. Hi, Dr. Arena.
Hello, Aisha. Nice to meet you. Nice to see you today. I hope you're doing well. Yeah.
Alhamdulillah. Let's start it with basic. Now, my first question from you, ma'am, that what exactly is panic attack?
Okay, actually, panic attack is a sudden surge of intense fear or discomfort that reaches the peak of the minutes. It's caused by activation of the bodies. It's like response when it's not as a real physical danger. Yeah, but during the panic attack, the body releases stress hormones such as adrenaline. So, and this leads to the physical symptoms and can feel very alarming. This is what we understand under the meaning of the panic attacks.
Okay. Thank you for providing such a clear explanation, ma'am. Now I have some more questions related to this topic. What
Yeah.
are the common symptoms patient experience a lot?
Yeah, so the common symptoms is the physical symptoms the patient experience. It's rapid heartbeat, palpitation, some kind of chest pain or discomfort, as well as the shortness of breath, kind of dizziness and lightheadedness, and maybe some kind of sweating, even a tremor in the whole body, nausea, some kind of tingling sensation. Yeah, it's like some patients even have a fear of dying or losing control. So this is seems really realistical, and for some patients, it can be like feeling as a life-threatening disease.
Mm-hmm. Such a great clarification, ma'am. Now I have next question is that why do panic attack feel so similar to serious medical emergency? Can we explain these things?
Yeah, thank you for the questions. I would say that because some physiological systems are involved. For example, as I said before, they it can be like heart, like palpitation. Yeah, so the symptoms that mimicking the heart attack symptoms. So palpitation, chest pain, sweatiness, dizziness, as well as this, it can mimicking like a respiratory distress. When the patient can show like breathlessness, they say that they just come into you and they saying, "I'm gasped for breath." So they can't catch their breath. As well as this, they can have kind of neurological symptoms like dizziness, lightheadedness, and even tremor in the body. So this is
Mm-hmm.
mean that like our brain is sending a signal and giving us that we are in danger, like sensation, feeling of danger. So, and this can increase our anxiety, our fears, and this is like a cycle that you can, your physical symptoms are involving
Mm-hmm.
you stressful situation, and you can feel that you in such a position that you can't control your body.
Mm-hmm. Totally understand, ma'am. This is the most important question, and I think so. There is more preferable question that what should the main difference between patient attack, panic attack, or heart attack?
Yeah, there is panic attack symptoms. It's
Mm-hmm.
often like we have in like sudden onset. It's often during your stress or anxiety when you have such a
Mm-hmm.
kind experience in your life, when you have an exam following for the students, or you have like promotion in your job, and
Mm-hmm.
so after that the symptoms peak of the symptoms is within 10 or 20 minutes. And the symptoms probably most of the time it's gonna improve when you calm down, when you're sitting down, when you have relaxed time. So the panic attack mostly affecting, they can affect all ages of group, but mostly young patient. Yeah. So and this is like differentiation from the real heart attack. They can happen in more older patients. So
Mm-hmm.
as well as this. It's like emotional distress. So it's fair. You can actually distinguish if you try to ask your patient or the young man or woman a couple of questions. So you can bear in your mind that the stress is different than the physical chest pain. So and the heart attack, it's more like the patient or they're gonna tell you that they have heaviness in the chest, and it's spread to the joint, to the jaw, to the hands, and this kind of chest pain, breathlessness, they feeling when they doing some kind of job. So it's not like in the rest period, yeah, and the most like the background history, like diabetes, they've got like chronic condition, diabetes, hypertension,
Mm-hmm.
long-term smoking conditions. This kind of thing can clarify for you where is this panic attack, where is this serious condition that needs to be treated in the emergency department or needs to be seen by the general practitioner.
Okay, totally understand the difference now. Thank you, ma'am. Now, my last question from you that what symptoms should patient never ignore?
Yeah, definitely is such a great question. As everyone needs to know what they can experience. So first of all, if the chest pain lasts more than minute, like more than 20 minutes or half an hour, yeah, when the patient feeling like the chest pain, it's more related to the heart attack. Yeah, I'm explaining at the moment. So if the chest pain happening when the people doing something, like even the usual activity, daily routines, even preparing food or going just outside and cleaning the garden, just the usual work, and it can cause the chest pain. They can irradiate to any part of the body, any numbness of kind part of the body, any like fainting and collapse. It's really worrying as well. severe shortness of breath, that the people gasp for breath, they can't breathe properly, and they need oxygen and they need treatment in hospital. As well, as I said, kind of numbness, the part of the body, any kind of difficult speaking, they confuse, they can't tell you where they are. Yeah, like this
Mm-hmm.
kind of symptoms as well. As well, you need to be aware of medical background, like if they haven't suffered from diabetes, hypertension, yeah. So you need to seek a little bit of background history. Just ask the question that could be related
Mm-hmm.
to the medical condition that we would like to differentiate from the panic attack.
Mm-hmm. Thank you. Thank you so much, Arena. Great. You explained very well. Thank you so much, ma'am.
No worries, you are very welcome. It's always a pleasure. Thank you, Aisha.
Thank you so much. So,
Was
this is the last question from
you
my
think
side.
about the question. The question was very, very knowledgeable, and I think so. This question helps to differentiate panic attack from chest pain and any other kind of neurological
Okay.
diseases or respiratory kind of
Okay.
patient can suffer.
Thank you so
Thank
much, Dr. Arena and Aisha. On behalf of myself, Miss Aisha Batul, and the entire healthcare and health medical community, a big thank you, Dr.
No,
Arena,
thank you so
you're well welcome. Thank
for sharing
you. Much
such
appreciated.
valuable insights and helping our listeners better understand when to stay calm and when to seek urgent care. Your guidance today will truly make a difference for many people. And of course, thank you to my wonderful co-host, Miss Aisha Batul, for being a
Thank
part
you.
of this meaningful conversation.
You're welcome, ma'am. You're welcome. Your appreciation is very well.
Yeah, much appreciated.
Thank
Really
you
nice.
so much. Uh, if you found this episode helpful, please share it with your friends and family because awareness can save lives. Until next time, this is Asma signing off. Stay safe and take care of your health. Allah Hafiz and see you in our next episode. Bye bye.